Welcome back. You're still watching Daybreak, and the two old friends have been going at it during the break. That is Governor Kangata and Senator Kajwang. What are you saying, Governor?
Yeah.
You should go on record.
Go on record. What was that? What did you say?
No, we are talking about serious Muranga issues. Yes.
You can be sure it's not. But Conrad, as you listen to these conversations, and especially when it comes to, you're looking at, what is it called, the County Integrated Development Plan, plans that counties have. What for you has been the experience in terms of that guiding principle that is sort of medium term versus when governors come and they have their plans, or is a struggle to align with what has been set in place by previous regimes or previous governors versus now coming to align the vision of the new governor with that?
Okay, thank you very much. But I think you should actually stretch it further. Because there is a requirement that national and county governments actually cooperate and consult, especially on planning, so that we have some cohesive national plan that has county inputs, that also has national government inputs, and that there is cohesion. So the first challenge, of course, is this political transition that we talked about, and its management, and especially when it crosses over and sort of becomes an impediment in technical planning processes. Thankfully, CIDPs, the County Integrated Development Plans, are aligned to the term of a governor. So therefore, a governor can have their vision, implement it within the time of office. But the nature of development and advancement requires more than 5 years. Maybe the investments made in 2013, some of them are being realized now. Improved literacy rates or improved health and nutrition as a result of the initial investment. So therefore, I agree with you, Sam, that we actually think, we need to think long term. We need to think beyond 5 years. And this can only be achieved when there is not that interruption as a result of political transitions. And as I said earlier, it is actually possible to achieve that, where you separate political promises, undertakings, and all that, and then a very technical process of understanding the constitutional mandate of county governments, the policy requirements, and here we are talking about national and all that. And this brings me to a very important point, the role of the national government in actually the effectiveness of county services. So you find that, as Governor Irungu mentioned here, that he has his vision, the 3 issues that he said that we do this. Another governor has that. But we have a constitution that provides for all citizens equality of services and all this. So if I may give an example, there is a World Bank report that came out in November 2021, which mentioned 2 counties, Turkana and Tharaka Nithi. And it actually said that while in Turkana there is, in the ECDE facilities, the teacher-to-pupil ratio is 1 to around 35, 38. In Tharaka Nithi County, it's 1 to 70. Yeah? So you see those disparities can actually be addressed because they are affecting the quality of lives in 2 counties, and they can actually be addressed where we have sectoral standards of service delivery. We say each county government, yes, you have your promises, but in this sector, these are the minimum standards. And the same thinking and rationale should be extrapolated to all kinds of services, so at least Kenyans have the services equally as provided for in the Constitution. And for this to be addressed, there's an extensive review of laws and policies in the sector service delivery, as well as the laws are harmonized and, more importantly, monitor and evaluate the performance nationally, sectorally, to see whether county governments are meeting national standards, which are developed in consultation with and in participation of county governments, then we have that advancement. So I know it's a very ideal thing to talk about, but there's some practical ways in which such processes can be aligned. And once we do that, I think even the challenges of political transitions where development activities are disrupted because of change of government might be minimized because there's a clear vision at the national and county level on sectoral targets, advancements, and all these are informed by national frameworks.
Right.
Yeah.
And Governor, let me just get back to the governor before the senator, because yes, you're saying that you're focusing on the healthcare, which is part of your promises, but also one of the key county or rather devolved functions in this country. And when you look at different control of budget reports, they show you that close to, is it 40% or even more sometimes, some counties got up to 60% of the budget goes to healthcare. Have you been in a position to really find out what are the main challenges that the people of Murang'a face when it comes to health, the key ailments, so that then you know how to intervene? For instance, if the predominant issues are chronic diseases like diabetes and high blood pressure, how are you fixing that to ensure that you have specialists at various hospitals, or you improve the facilities, the testing labs, or what you may need to really address that?
Definitely, Murang'a greatest disease burden is in what we call non-communicable diseases, that is diabetes, high blood pressure, and such. And that has something to do with the lifestyle and also the kind of food that we eat. And definitely, the interventions are many. Number one, we have instituted what we call community health volunteer scheme. We did fresh recruitment, and soon we shall be teaching them on how to do some intervention on matters non-communicable diseases. Secondly, provision of drugs at the level 1, level 2, level 3 aspects to ensure those who have chronic diseases can easily get those drugs. The other intervention definitely is in the area of public education. You try to alter behavioral choices so that you prevent diseases as opposed to intervening at the curative stage. But most importantly also is to try to ensure various hospitals and entities, they get their cash transfers from our treasury early so that they can plan in advance. Before we came into government, everything was reposing at the county headquarters. If you wanted fuel, let's say there's a place called Kangare. Kangare is in Kegumo, almost in the forest. So if you are a health center there, you needed to go all the way 80, 100 kilometers to Murang'a town to refuel. So we tried to devolve some of those small issues, and that way you increase efficiencies when it's come to purchase of key drugs, so that you improve efficiencies as opposed to centralizing everything. And we hope those interventions will go a long way towards alleviating some of the problems people are having currently in Murang'a County.
That's interesting. If people are feeling such, I mean, they have to travel to come and feel.
Incidentally, by the way, the justification that was given, and I think Mr. Kajwang can help us, the reason that was given by the previous regime was somehow based in law, which is, according to Public Finance Management Act, every coin of the government, whether own source revenue or whatever, must be domiciled in a single account called county revenue account. And so in short, you collect all the money, you sweep them into CRF, and then you requisition. You requisition meaning your county chief officer of finance does some requisition to Nairobi to control budget, so that now you can get the money and you send it back. So that then meant all the money our hospitals were collecting, they will be swept into that account, and then the process of requisition, which goes all the way to control budget. Because there is one of the cardinal things you can do as a governor or even any entity in government is to spend at source. That generally is unfair in a way when it comes to matters health. The reason being, even an ambulance, you'll be told to go and fuel in Murang'a town, or you wait for the requisition to be done all the way to Nairobi. So there are two ways to circumvent that problem. Number one, you can establish a county legislation that allows certain sectors to spend at source. Yeah, but some people have argued a county legislation that is in conflict with public finance management law is illegal. Yeah, so there's that. It's a gray area. There's a huge discussion along that issue. Secondly, there is what you can do is to do advance requisitioning. Yeah, you tell your guys to give you requisition well in advance. You requisition even before there may be certain deadlines come in, so that when they require the money, you're able to wire it well in advance to avoid a situation where they have to come all the way to Murang'a to seek fueling of ambulances, which is a life and death choice.
That's interesting. Senator, because you've previously sat at what was called the County Public Accounts and Investment Committee, so CPAC was dealing with both PAC and PIC issues. I mean, how do you explain that? Because I'm just wondering, you can tell how much, even if it's your household, you can tell how much it's going to cost you in February, because based on historical expenditure. How then do you make it efficient for counties so that, yes, there's the requirement that you can't spend at source, you have to deposit the funds with the National Treasury, then you can requisition. But how do you help the planning?
There's, I think Governor Kang'ata has alluded to the solution. The PFM Act and regulations allows county governments to establish funds, and those funds must be approved by the county assembly, and each fund must have its regulations. What we have done in the past is to recommend to county governments. I'll give you an example of Mombasa. The Coast General Hospital is a county institution. Now, at some point, all revenue collected at the hospital would be swept back to the county revenue fund, and then the hospital administrators had to almost beg for money to come back to do simple things at the hospital. We encouraged Governor Joho then to establish the Coast Provincial Hospital as a county corporation with its own fund, which means that when they collect, they deposit in the fund that has been established rather than the county revenue fund. So that is the option that county governments have to ensure that the services, particularly in the health sector, are not crippled. And I've seen more counties are taking that approach because the needs in health facilities tend to be very dynamic and tend to be very urgent and instant. That if you're going to subject them to the entire approval process, including the control of budget, then lives could be lost in the process. As we proceed, of course, it's 10 years since county governments were put in place. I think there's need for a legislative impact assessment. I know Dr. Bosire, in the last parliament, when I was chairing the devolution committee, we had a lot of conversations around how well and how healthy the laws relating to devolution were. We are, keenly waiting to read his report, and that can help us also to amend certain laws that have become a hindrance to realization of the benefits of devolution. I'm glad that Governor Kang'ata also sat in the Public Accounts Committee in the last parliament, besides sitting in many other committees. We seek to work very closely with the Council of Governors to ensure that we iron out these issues. And I was a bit disappointed when the president did not assign specific responsibility on devolution to a particular person. Yes, if you read the Constitution, the de facto minister for devolution is a deputy president, because he chairs the Intergovernmental Budget and Economic Committee, IBEC. Right. And that makes him the de facto in charge of devolution. But it needs to be made explicit that when it comes to devolution matters, the one-stop place that you go to will be the office of the deputy president. I think the president must have pronounced himself to that when he went for the cabinet retreat. Even though the deputy president is a de facto head of devolution, the question arises whether in the many other things that he is constitutionally required to do, he will provide the necessary focus. The reason why, in as much as when Waiguru was appointed CS for devolution, people were saying, why does the national government want to have a minister for devolution, and yet devolution is for counties? Devolution is not just about counties. It is a delicate balance between county governments and national governments. And remember, we are a unitary state. There are a lot of things where the national government is still encroaching on what governors should do. President Ruto has been talking about housing. Do you know that housing is devolved? It is Governor Kangata who should be building low-cost houses. President Ruto should be dealing with policy. President Ruto has been talking about agriculture, implementation. He is supposed to deal with policy. And Kangata is the one who's supposed to figure out what kind of fertilizers the farmers in Murang'a need and what kind of input the farmers in Murang'a need. President Ruto has been, the national government has been talking about water. We have all these agencies that have nationalized water. You remember the conversation that Murang'a County had with the nation when Nairobi County wanted to draw water from Murang'a. Right. Water is a devolved function. We've been talking about roads at the national level, and yet national government only has responsibility over national trunk roads and Class C and above. The vast network of roads is with the county governments. So the reason why it's important to have that one person sitting in cabinet who from morning to evening, the only thing they eat and breathe is devolution, is to ensure that when Kangata has a problem with the Ministry of Lands or a problem with the Ministry of Health and a problem with the Ministry of Roads, he does not have to shuttle to all those offices. He just goes to one office, and there, they're assured that those issues will be escalated to cabinet. They're assured that those issues will be brought to parliament for legislative reforms. So I think now that we are going into the 11th year of devolution, right, let's do that legislative impact assessment. I want to encourage the president to make an explicit assignment of the devolution role to a specific person, and I would be happy if we have a CS for devolution, because there is so much work to be done. There is so much collaboration and coordination that is still pending between the Council of Governors, Parliament, and the national government to make sure that devolution works. In fact, Sam, my final word is that the way I envision devolution is that Kenya in 50 years will be like the United Arab Emirates. In the UAE, everyone knows about Dubai, and everyone knows about Abu Dhabi, forgetting that there are other small emirates within that union. There's an emirate called Sharjah, which is very chilled. It does not have the skyscrapers that Dubai has. I would like the ambitions of governors to be that their counties can be the Dubais of Kenya, not the Sharjahs of Kenya in the next 50 years. And that can only be done not through the tokenism that I've seen most governors prefer. Governor Kangata has talked about, he's always been a socialist. He's a friend of mine. He's not a capitalist by orientation. He's a socialist by orientation. And that's why you see his first project is to ensure that every household has got access to NHIF cover. That is a good social welfare program. But the one that is sustainable is to ensure that each household has got a basic income so that paying 500 shillings per month to NHIF does not become a problem, does not become a burden on county coffers. So Governor Kangata, shift from your traditional socialist approach and please ensure that the farmers in Murang'a, the households in Murang'a have got that disposable income. Therefore, they can buy their own insurance. You don't have to spend on bursaries. You don't have to spend on school lunches because your residents are capable of providing for themselves.
And of course, we'll get back to...
Can I defend myself?
You want the right of reply, briefly?
Not briefly. Well, let me say that as to my ideological orientation, I'm not so sure that I can describe myself as a socialist. Maybe I can call myself as a centrist who leans incidentally on the right. He's on the right.
Right.
Reason being that I'm a strong believer in free capital and in enterprise, particularly when you come from a county that has very strong entrepreneurial spirit, like Murang'a. And therefore, in fact, that's the reason why, even when it comes to public companies which are maybe owned by the county, we lean more towards private-public partnership as opposed to pure government intervention on matters public investments. And secondly, is the reason why we are also creating IT systems to make business more free and more efficient in Murang'a County. And therefore, with all due respect, my friend should not degrade my free market ideologies and convictions. But on the other hand, definitely, we must always remember Kenya has two problems. The first problem is the cake is too little, so we have to bake more. But also the little cake that we have is inequitably divided. Yeah, very few people are living well in Kenya from where I sit, and a large number of Kenyans are really suffering. Take like an insurance cover. Kajwang here has a very good cover. The last time I checked, it was with Jubilee Insurance, with Parliament, a very good one. Myself also, I have what we call premium NHIF cover. Yeah, I'm sure everyone here has an insurance cover. What about the millions of Kenyans who don't enjoy such services? Is that fair? That's what we call inequitable sharing of the cake. Yeah, you when you get to the hospital, you go to Nairobi Hospital, you flash out a card, you get all the services. What about the millions of Murang'a people who don't have that small cover? And the one they have is so restricted. It's only caters for inpatient and outpatient. That's why the one that we crafted in Murang'a, we increased the benefits of Murang'a people can get. As to his argument that we may need to lean more into income-generating interventions, I agree. I 100% support his view. It is on that basis that we have crafted what we call an agricultural subsidy program, which is basically the county government to send resources to our farmers. And you know, Murang'a is divided into two topographical and ecological zones. The lower part, which basically they do fruit farming, and the upper part where there's a lot of coffee, tea, and milk. So our intervention is basically targeted to those two ecological zones. So you intervene in milk, the upper part is happy. You intervene in mango, the lower part is happy. And you are dealing with what I would call the modern economy of fruits. And therefore, we think once we intervene in agriculture, I'm happy the assembly, we have a very progressive and very critical assembly that is keeping us on toes. They passed our agricultural policy, our regulations. We have now set up a fund, and therefore soon we should be disbursing that intervention directly to the farmers to improve incomes at the grassroots level.
Interesting. And Senator, I wanted to ask you about, from your experience, how a county is able to respond to issues that are specific to their areas. For instance, in terms of health, there are certain ailments that are peculiar in, say, your county or your region versus what would be the biggest concern for Governor Kang'ata here in Murang'a. How are they able to respond to that, knowing the challenges that are in the health sector, whether it's financing, whether it's the human resource, and also the supplies?
There's been a lot of focus on infrastructure, particularly when it comes to health service provision. One of the silver linings of the COVID pandemic was that it shifted focus on the capacity of county governments to deliver health services. And as a result, at least now, you'll find that each county has a level 4 hospital, and a few counties have level 5 hospitals that have got ICUs, CT scans, and MRIs that have the capacity to do basic diagnosis for some of the common ailments. What I would like to see, and there's been a conversation around regional economic blocks. The disease burden, looking at the 47 counties, it's very rare that you'll find a disease that is in one county and is not in the next one. I'll give you the example of trypanosomiasis, the sesefly menace that is in my county, the Lambwe Valley. But it's not only in Homa Bay, it also affects Migori. There is another pandemic which is forgotten, the HIV/AIDS menace, that is endemic around the Lake Victoria, the counties that surround Lake Victoria. if you start looking at things from a regional perspective, it then helps you to build more deeper capacity to deal with some of those disease burdens, such that counties coming together can put more resources, more than one county dealing with it individually. We saw within the Lake Region Economic Bloc, Kisii County at that point was picked as the flag bearer for as a model for health. And so Kisii County put a lot of investments in terms of revamping their health infrastructure, software, and human resource issues. So Sam, I would prefer that counties and governors, despite their sovereignty as individual counties, to encourage them to build blocks and to build cooperation with neighbors. That way, they'll be able to more effectively deal with some of those challenges, not just the health challenges, but the economic challenges, and also just dealing with the law of large numbers, that if you come up with an intervention and you've got a bigger base, then perhaps the impact would be much greater compared to if you're just doing it for a small population within your county.
Right, and Dr. Bosire, so yes, counties working together, but in the last election, we still had health becoming one of the issues of the campaign, whether it's at the counties or at the national level. And one of the calls was for a health service commission. So many years since this devolution, but still find that the healthcare workers are still uncomfortable being managed at the local level. What then is the ultimate solution if the medical workers feel, no, I don't want to be employed by a county because I am afraid that my terms will not be as good as I would have wanted? How do you make it meaningful for the healthcare workers, but also useful for the residents in these counties?
Okay, thank you. I think one of the main challenges that the health sector faced, and if you compare across agriculture, education, the health sector is actually the one that gave us an experiment of success or failure in devolution, because the Ministry of Health actually, for some reason, really engaged, and there was transfer of budgets, transfer of things very early on in 2013, and as other sectors and sub-sectors caught up in implementation. But on the issue of Health Services Commission and the grounds which have been advanced to support that, you know, and this goes back to what Governor and Senator have been talking about, the joint management of critical services in the country. So, for instance, training and capacity building. Let me take that example in the health sector. So you have training standards. Yeah, we want doctors who can treat anyone, anywhere. And this calls for some national minimum standards in terms of capacity development. Yeah, not just universities, but when on-job training. And this is actually to be coordinated from the national level. But what happened is that standards of training, quality assurance, promotions, and the standardization of that was not addressed well from the start. So therefore, we had the transfer of doctors, transfer of payrolls without harmonization, and then there is now the budget cycle challenges that county governments face. You know, what could have been done, for instance, HR management as a component of management of health professionals could have been deferred until there are structures to harmonize training, capacity development for some time. What happened is that this was done big bang. Yeah.
So what do we do now?
So one of the solutions, like the health professionals, if you ask any nurse in any county government, typically they'll tell you for the last 2-3 months we have not been paid. We are assured this month the salary will delay and all that. And if you ask the governor and the health minister, the county, what is happening, they tell you basically it is transfers from the which are not happening. But my view is that going forward, and the two levels of government actually critically discussing how to ensure quality services in the health sector and which components need to be managed well. So at the end of the day, you may go for the Health Services Commission, but this is an intervention to stop an immediate challenge that health professionals are facing in the sector as a result of this, the effects of the mismanaged transition process. And actually, the national government and county governments need to lead discussions on standards, especially in HR management, so that a doctor in Turkana, a doctor in Tharakanithi, a doctor in Isiolo, in terms of promotions, maybe sometimes remuneration, in terms of quality assurance of services, that especially the Ministry of Health and its evaluation teams are on top of this. The other thing is sharing of critical resources. Or critical human resources in the health sector. So we may, first of all, if each county is to employ, for instance, cardiologists, we may not even have that number of cardiologists in the country. And even if we do, you might end up paying salaries of cardiologists and forget primary health care. So there's a way in which the Ministry of Health and counties should place or locate critical strategic health services in the country, make use of the former provincial government hospitals, cancer centers, and specialized treatment that cannot be devolved to the very low levels because of the expenses involved and the budget support that will go with that, and even the technical capacity in the country, which is limited. If we are able to set standards on the levels of services needed, equip institutions that are to offer those levels of services, and then have arrangements. Like, for instance, there's a special grant in the national budget that goes to the provincial health hospital so that it pays for these critical services, because you find like the PGH in Nakuru serves people from Bomet, Kericho, and all that. So therefore, the ministry, and many of the county referral hospitals, because not all the 47 counties have county referral hospitals, they serve from across the county. They have kidney centers, you know. So those, if we can have a policy on management of strategic health services, and then you ensure that primary health care is devolved to the communities, and they have the personnel and competence, plus what Governor Kangata was talking about, the community health volunteers. That is part of the primary health care. Those can be in every county and reach every village, because the resources required are relatively easier than the other critical services. So those arrangements. And then things like, let me re-emphasize that human resource management, the Ministry of Health, in consultation with counties, has to take care of that aspect to ensure that there's motivation among health professionals. And if the option is a Health Services Commission because of the practical challenges we face, then define what that does, its relations with county governments.
Governor, would you know how many specialists you have in your county health facilities?
Yes, I do, and I don't know what you precisely mean with that candor, because you can say doctors are specialists, but Murang'a has about 130 doctors in the entire establishment. 130
doctors for the entire population of Murang'a County.
Yes.
But how many how many of those have specialized? Maybe they're cardiologists, they deal with renal issues, they deal with diabetes issues, like what you were saying is the biggest challenge?
When you talk of specialization, I guess you mean persons who have, number one, a master's degree, number two, long experience of practice. Those ones can't be more than 20.
Not more than 20.
Yeah.
And therefore, if you were to build that HR for Murang'a County, are there any specific interventions? Because it takes time to train, it also takes resources to train. Are there any specific interventions that you are looking at to build your own sort of healthcare manpower?
Yes, number one, those who seek to do advanced studies in medicine, Murang'a allows them to do so. At times they even go 1, 2, 3, 4 years. They are studying and we are paying them. So, and they are not even in Murang'a. And it's because we believe in educating our workforce. We also believe once they finish their workforce, they'll come and offer specialized services. And therefore, our human resource in health sector will have very good skills. So I think that is one of the reasons.
Have they been coming back, or they disappear after that?
There is something called bonding.
Yeah.
You bond them, and which we hope they will adhere to the terms of the bond. And there are those who come, there are those who don't. Those who don't, then we have to enforce the terms of the bond. But there are those who definitely come. There is even one doctor, he's called Dr. Irungu. He is based in Kenneth Matiba Hospital in Keno. He is a specialist on matters dental care. He is past his retirement age, but we have purposefully retained him in Keno because what he offers is so unique. You may not find it in the open market. And we are happy that he continues to offer specialized services for the people of Murang'a.
Yes. Senator, do you have thoughts? Because yes, even as counties come together regionally to invest in certain infrastructure, how then do you deal with the question of HR? Because like currently one of the biggest challenges is cancer. When you talk about specialists, they are not sufficient. Actually, they are very few to the extent that treating that becomes very expensive, not just because of equipment, but also because of the manpower. Do you have specific proposals on how to deal with that?
You know, we've spoken about healthcare. Just before I get back to it, it would interest you to know that some counties don't even have a vet, you know, someone who studied veterinary medicine. You'll have people who did diplomas or who did those subsidiary courses. But if you look at many of the counties, they do not have a qualified veterinary, you know, doctor. Let me not call it officer, veterinary doctor. And that's where the problem lies. In many of our counties, you've got these border riders. And with border riders, there are accidents. And bones get broken. And faces get deformed. The guys who fix bones, I think, are chiropractors. And that's a specialization. And the guy who fixes messed up faces is a maxillofacial surgeon. It is not feasible for each county to have a chiropractor and a maxillofacial surgeon, plus those other general surgeries. And that is why the argument around pooling of HR is important. And that is why I support the establishment of a health service commission. That will be a centralized pool for setting standards, for ensuring that there is consistency in remuneration, there's consistency in compensation, there's consistency in training, and counties can devise their own additional programs to ensure that they then attract people from that pool. The argument that because health is devolved, then the doctors must be directly employed by the governor. Medicine is such a specialized field of study, and we do not have enough doctors in this country. And we are not going to have, in the next 10 or 20 years, enough doctors or specialists to take care of our counties. If I was President William Ruto, I would have fashioned my first proposal for constitutional amendment around strengthening devolution. I would have listened to the plight of healthcare workers who have in unison said that they are not opposed to working in counties. In fact, I think that if they are well motivated, you'll have more people working for county institutions or county facilities rather than the private facilities. Because the conditions in private facilities, even though the pay is good and consistent, but it's a very strict 8 to 6 or sometimes even 8 to 8 kind of work, which many doctors or health workers don't like. I would have fashioned a constitutional amendment around anchoring the Health Service Commission in law. I would have promoted a constitutional amendment and put a question around Nairobi County. Nairobi County is so complex. that it is not going to be run properly by politicians. Nairobi County would benefit from an arrangement similar to what we had. We criticized it, the Nairobi Metropolitan Service. In fact, it was Kangata who promoted it. That time he was the whip in Senate. He really promoted it, and the likes of Murkomen opposed it, and it set the ground for the conflict that eventually led to the rupture of Jubilee and to the ascension of William Ruto as president. In my view, and if you look at a very interesting cartoon in this newspaper, the deputy president, who I earlier said was the de facto minister for devolution, you see his approach to Nairobi is not an approach that is useful. You cannot have Nairobi run merely by politicians. Nairobi needs to have a technocratic arm, a technocratic unit that runs it in cognizance that Nairobi is the headquarters of the UN Environment Program, UN Habitat. Nairobi is a logistics hub for the region. So if I was President Ruto, I would fashion and I would put a question on how to restructure the administration of Nairobi. I would put a question on the number of counties, 47. Here we are talking about going back to regional blocks, telling you that we are too fragmented. I would put a question around the functions that have been assigned to county governments. I feel, Sam, that in this conversation around CDF, and even though some of my colleagues in Senate have said CDF should be scrapped, I support CDF. I support the thought that the national government can send some money for use, for implementation, and for development at the constituency level. The only thing I don't support is the manner in which it is managed. We get politicians out of it and let CDF be run by the public and be run by national government structures. Alternatively, which is even a better approach, we give that CDF money to county governors as a conditional grant, so that county governors, Kangata, can be able to upgrade a secondary school within his county, or can be able to upgrade the chief's camp within his county. Those are the conversations that, in my view, merit a constitutional amendment at this point. They should be around devolution, rather than the issue of positions of leader of opposition or whether cabinet ministers should come to parliament.
That is interesting. And Governor, just before Bosire here, how then are you reconciling the ambitions of the national government and those of the county government? Never mind that you come from the same political formation, but how exactly are you doing that, knowing that also you have challenges that you have to contend with on the ground? If it's the question of cost of living, the government may be approaching it from financing the subsidies for the long-term goals, but yourself, how are you achieving it?
I think the national government goals can be aligned with the county government goals. Take, for instance, the issue of affordable housing. Our role has been to provide land, which Murang'a County has done. When it comes to matters fiscal responsibility, cutting some expenditure, again, we support that. And also we try to adopt those values so that you also have a very efficient government that can respond to its citizenry. When it comes to our flagship projects, like what I've said, agriculture and health, you have to do a lot of collaboration with the national government. You be aligned with them. And I think the national government has, from where I see it, has done a good job to ensure we are running. Of course, there are some bottlenecks, and I agree with Kajuan to that extent, that the national government needs to do more. The most outstanding bottleneck on matters devolution from a national government point of view has been exchequer delays. For the last 6 months, the national government has only sent 3 tranches of money. We have not been given money for December, November, and in some counties, October. You'd imagine, how do you pay your salaries if you have not been given money from the national government? Yeah, like Murang'a's salary envelope per month is about 360 million. So you really needed to be very innovative to be able to address that issue. Yeah, and us, we have been sufficiently innovative. Before we came into government, Murang'a public employees in county used to be paid after 5 months. We have been able to cut that. Now we are almost paying them monthly. Of course, there's 1, 2, 3 weeks delay, but people are no longer waiting for 3 months.
Which is the last salary you paid?
Yeah, we have currently people are being paid December salary currently as we speak, which for me is progress, because previously people used to wait for 5 months before being paid.
Interesting. And so, Dr. Bosire, yes, I've heard this so many times, the late releases of Exchequer. Then the explanation is that the collection also is late, the collection of the revenue itself. How do you streamline this? Because it is known how much Murang'a County, for instance, has budgeted for in this financial year. How better can the national executive or the national government plan resources, knowing that the 47 counties are going to suffer if that is not done?
Okay, thank you. Yeah, I think it's a challenge for counties, and you do not need to look at reports. We have relatives, friends working in a county government, and you tell from the challenges that they are facing. I've sat in forums where the agencies such as the Control of Budget and National Treasury have talked about these issues. And sometimes what you hear from them is we do not delay because there's bureaucratic delays or anything. It's because there's no money to send at a particular time. That is the confession you get from, for instance, the Control of Budget or National Treasury officials when they address this issue. But I still think there is a space for certainty in planning and allocation of resources. And I think the National Treasury and the systems and procedures and steps they have whenever revenue is received from the Exchequer is important. The transparency of what comes in, the transparency of what is prioritized at the National Treasury, and predictable plans for county governments, such that it is, you told on the basis on reliable plans that at least you are assured of this kind of resources, even if they are not full at a particular time, and it's on the basis of these realistic estimates. I think what happens in the National Treasury is that monies which come in, the priorities may not be rationalized, and maybe county governments and the salaries do not rank whenever money hits the accounts for disbursement. We've seen the Senate come up with the cash disbursement schedules for the National Treasury. And this, I think, Senator Kajuang should form the basis of oversight with the National Treasury for purposes of enforcing it and actually looking at the disbursements of the National Treasury vis-a-vis the requests and vis-a-vis the Treasury's own plans, whether it's rational and whether the little resources that trickle in are actually prioritized in a transparent and consultative manner, including the essential expenses for county governments like salaries. If we do that in the midst of the challenges of resources to disburse, I think what governors need in their hearts, I think, is predictability. So that when you tell your workforce this is coming, then it's coming. Yeah, it doesn't rely on personalities, it doesn't rely on friends, the National Treasury, but that there is an objective way in which this is managed.
I know, Senator, you want to add something, but have you had delays in salary payment at Parliament?
I would have loved Senator Kangata to confirm which month he was last paid. His workers are being paid for December. I'm sure he received his December pay way in advance. But Sam, that's beside the point. Governor Kangata says he spends 360 million a month on salaries, which translates to about 4 billion a year. My vision of devolution is that we will get to a point where this 360 million per month can be financed by on-source revenue, so that whatever comes from the Exchequer is purely for development purposes. And this is possible when we move beyond the mundane and start thinking in a transformative manner. Start thinking about how to put money in the pockets of the people. Even the bottom-up philosophy that we are subjected to during the campaigns, the best approach to achieving bottom-up is through devolved governments because of that principle of subsidiarity. The national government cannot push bottom-up from Nairobi. Bottom-up can only be pushed through the 47 counties and the various wards and the various villages that are there. So this constant cry about delays in remittances from the national government, we must also put governors to task. What are you doing with the locally collected, generated revenue? Because every day tax collectors are working in markets, and every day in taxi parks, every day in border stations, and in every county you'll find a rope that has been put, waiting for people carrying sand and stone and those carrying agricultural products. Can we optimize our own source revenues? Can we make sure that there's transparency? In many counties it is collected, but it goes into people's pockets. So I want to challenge Governor Kang'ata, because I know Murang'a is a very rich county in terms of output. In fact, I believe that Murang'a's gross county product is fairly higher than many other counties. It should be in the top quartile when you look at GCP. 326 million that you pay as salaries, Governor Kang'ata, that I believe you should be able to generate from on-source revenue. Of course, it's not that easy that you collect from the market and then you pay salaries. But when you annualize it, you might realize that this issue of blaming the Treasury for delays in payment of salaries might be a red herring. The solution lies in effectively, efficiently managing our own source revenues, growing it, and we can only grow it if we focus on productivity within our counties.
You didn't answer my question. Have you experienced delays at Parliament in salaries payment?
Yes, we have. In Parliament, we also depend on exchequer releases. And so when Treasury does not send money to Parliament, because Parliament draws money from the fund, there'll be delays in...
How often?
It happens almost, for example, whenever there's a transition, whenever there's a new financial year, it takes about 2 months or so for money to start flowing into Parliament. So it has become something that we have built in our systems. We know that every July, August, September is a dry season. You might even have some delays in payments of salaries and allowances. And it is unfortunate because Parliament does not collect on-source revenue. Right. But I'm saying that for county governments, that should not be an excuse, because every single day they're collecting money from people
but he'll tell you they are tied, that they have to deposit it with the County Revenue Fund account.
Yes, but the CRF is their own managed fund.
Yes, I think, yes, indeed, he's right to the extent that we must be innovative and collect as much as it ought to be collected. And that explains why our digital agenda ranks as one of our most important endeavor. We have created a standalone department on matters digital so that we collect efficiently, not only for our favor as a government, but also in favor of the Mwananchi. Because also Mwananchi has that right to be treated fairly and to interact with the government in a more efficient and cheaper way. But on the other hand, you must also be wary of what we call overtaxation. Yeah, if you overtax people, investors will run away from the county. There will be no employment because people will view your county as being a county that overtaxes business community. And therefore, we tend to craft what we call a conservative finance bill. You know, finance bill is the legislative document that you use to levy fees and charges. Right. That is the market, I don't know what. But you are always a little bit worried to increase the various charges because you do not want to overtax your people. So the one of the best way from where we see it is to first create efficient methods of collection of money. Once you create those systems, yeah, and then at least the revenue on its own motion will rise up, and that will be progress. And I think that's our endeavor for now, so that we seal all loopholes. We see to what extent you can be able to increase your own source revenue. And then next stage now you can consider what you're saying to see whether there are new revenue stream you can get. And like now, God willing, we shall purchase what we call a geolocation system. At least you know your businesses, where are they in Murang'a? Yeah, you're able to map using satellite all your businesses in Murang'a. And maybe through that, you increase our own source revenue.
Okay. Interesting. Well, I checked what you said, Senator Kajwang. Murang'a, according to some reports here in 2020, they were number 13 in terms of the gross county product, their contribution to the national GDP. But of course, Nairobi dwarfs all of them. Anyway, thank you so much, Dr. Conrad Bosire, Governance and Devolution Consultant, Senator Moses Kajwang from Homa Bay, and also Chair of the Public Accounts Committee, and Dr. Irungu Kangata, the Governor of Murang'a, for making time for us. Do we have time for feedback? Yes, we can take a look at some of them on what you've been saying via Twitter, Citizen TV Kenya, at Sam Gituku. The hashtag to use is Daybreak. And Engineer Lazaro, you're saying that MCA should be patriotic to their respective counties and apply some decorum in their debates, or else they risk being seen as useless self-seekers who lack merit. Whoa, okay. Oringe Waso, you're saying that the Kenya Kwanza administration has an opportunity of showcasing leadership by ensuring that they have put proper plans in place to enable counties to serve wananchi without unnecessary excuses and run around blame games. Godi Baraza, you're saying that the success of the Ruto-led administration will be realized through the seamless flow of service delivery in county government. If these devolved units of government will succeed, the ripple effect will be felt at the top. All right. Then, Sawa, you're saying that the national government should make it a priority for funds to be distributed to the county governments on time. This will enable seamless service delivery on both levels of government. And I want to thank you all for sharing your feedback with us. We continue with these conversations as we settle in the new year. My name is Sam Gituku. See you again some other time. Up next is Matters Social with Willis Raburu.